You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. Thank you for joining me. You're listening to the Dental Zone podcast. I graduated dentistry in 1992 and have been working as a holistic dentist since 2001 with my own practice here in Brisbane. I believe that to have a healthy life, you need to have a healthy mouth, and that the impacts of your dental health, the dental materials and the dentistry that you have a relationship with your health and well-being and vice versa. So today I'm going to talk more about what it is to be a holistic dentist and what that really means. And you can always hop on over to holisticdentistry.au to find out more. But for now, let's get in the zone. And so I get asked a lot of questions as a dentist, and some of them are a little bit left of centre being as I'm holistic. So I thought tonight I'd share some of that expertise, sort of like these are my frequently asked questions. It's really important to me that I empower and educate people to understand about their dental health and how that impacts on their wellness. So one of the questions I've been asked is about my philosophy to dentistry, and that it's more than just sort of fixing teeth and what that means. So for me, it's not just about, taking teeth out or removing fillings. There's nutrition and body chemistry, and for me, that all fits together. So mainstream dentistry really focuses on alleviating pain, restoring function, and preventative care to some extent. It's understood that plaque bacteria present in the mouth, they feed off the sugars in our diet, and that's what causes decay and gum disease. But it's also caused by poor or inadequate brushing and flossing, poor oral hygiene. However, this doesn't fit when I see patients who've got super, super clean teeth. They've got a diet that's low in sugars. They don't have a lot of acid, yet they still get cavities and gum problems. And I wanted to know why that happens, because it's super frustrating to see someone who is doing everything they've been told, they're doing everything right, and they're still getting dental disease. Now, natural medicine approaches illness from the angle of treating the body and the systems and the biochemistry rather than just addressing the symptoms. So it makes sense to me that if we can apply that to the mouth and teeth, that if a person has doesn't have enough minerals, vitamins or proteins, they've got emotional stress or chronic illness, then the body is out of balance. The liver's got to work hard to clear toxins, systems become acidic, and that's going to lower the immune response and cause inflammation. Then that acid builds up in the blood, the urine and the saliva. And saliva is supposed to be alkaline. It's supposed to neutralize the sugars and the acids from bacteria. But if your saliva is poor flow or it's acidic, that's going to draw minerals. So having an acidic body is going to draw more minerals from your already depleted body. So essentially what happens is the teeth become more prone to decay because minerals such as calcium and magnesium are required to balance the acidity in the body. Acidic saliva dissolves your enamel, so instead of protecting the enamel and aiding in remineralization and strengthening the teeth after eating sugars or foods, it's actually damaging them. So if we can balance the acidity in the body via nutritional support, you should be able to help prevent decay. Now with gum disease, there's a lot of factors at play. It's not just bacteria and lack of brushing or flossing, although that is, going to play a big role. If you don't break those bacteria down and get them out from around the gums and teeth, you're going to have a problem. But gum disease is an inflammatory condition. It's a response of the immune system to the bacteria. So if we can address this by reducing inflammation, boost the immune response, and we can do this through nutrition and supplements like vitamin C, zinc and coenzyme 10, then this should make a difference to gum health. I mean, we see patients who are coming for gum treatments and they're just not improving, and that's because they've got underlying nutritional deficiencies or systemic problems that haven't been looked at. So I get asked, that why is it you'd been a dentist for like 9-10 years before you started looking at holistic health, and what set me on this path? What was the light bulb or the aha moment for me? Well, when I trained as a dentist some years ago, we had no training in nutrition or in the safety of materials. In fact, we were told that once you mix something like mercury and amalgam into the metal alloys, that this is now perfectly safe. Go figure. However, not long after I'd started working in general practice in the UK, I realised that the suction units, the bit that sucks all the spit up, actually has a filtration device, and that captures the chunks of amalgam, the filling that's drilled out of the tooth, and that the dental nurses had to wear protective equipment and they had to empty that filter into a special jar containing chemicals so that the amalgam that we'd caught couldn't outgas mercury. So you're like, this stuff's supposed to be safe, yet all of a sudden when we take it out of the mouth, it's not. And once that jar was full, it would be collected and it would be taken away as hazardous waste material. Legally, we are not allowed to dispose of amalgam down the sink or in the garbage. And that stuff that was out of the mouth was identical to what I was drilling and placing in the teeth. Yet, now it's a toxic waste product. I mean, how could that be? It didn't make any sense to me. So I started asking questions, but back then there was very little information. We didn't have the internet. And working for the National Health Service, we weren't allowed to use any other filling material in the back teeth other than amalgam. Front teeth, we could do white ones, but my hands were tied. And I graduated in 1992, and I think it was in 92 or 93 that, only very early on in my career, that the BBC Panorama program, they ran an expose asking how safe is amalgam? Are your fillings making you sick? Now, the dental board, British Dental Board, wrote to all dentists. We were sent a pamphlet, it was a really thick booklet with all their scientific information telling us how safe amalgam was. However, a few months later, we were told by the same dental board, do not drill or place an amalgam filling for pregnant women because there is a theoretical risk to the fetus. Now, that's very curious when this is supposed to be such a safe material. And what's interesting now, that from the 1st of July in the European Union, dentists are no longer allowed to place amalgam in the mouths of children 15 years and younger. They're also not allowed to put it in pregnant and breastfeeding women, is my understanding. And I think there's some regulations around the elderly or people with poor health. Now, they're saying this is because of environmental issues, that amalgam from dental practices is a big environmental pollutant, which is true. But my question then to the dental profession, I look like a newsreader, sorry guys, I'm in that mood. My question then to the dental profession is, why have you picked those groups to not use amalgam in? Those groups are what are considered higher risk and higher susceptibility for mercury toxicity from fillings. So it strikes me as a bit odd that if it's about in the environment, why have we picked these subgroups? Why have we not just said, okay, we're going to have a 50% reduction in use, or, we're going to push towards using white fillings across the board? There's some questions there for me that are quite unanswered. Well, back to my story. How did I become a holistic dentist? I moved to Australia for my own health reasons and a lifestyle change. Because 8 years in the National Health Service had, frankly, completely worn me out. And looking back, I do wonder how much my own exposure to mercury day after day have played a part in my health. Now I only handle amalgam following strict protocols using SMART guidelines, which is safe mercury amalgam removal technique, which Evolve Dental is certified in. It's interesting that I feel much healthier at the end of my 40s than I did in my 20s. Another question that goes unanswered. By pure chance, and look, really, I don't think there's any such thing as coincidence, I got a job in an amalgam-free practice. At first I was still a bit sceptical about the merits of what we were doing, but I really loved working there, and, because I wanted to work there, I followed the guidelines. But shortly after being there, I started noticing changes in my patients' health. I had been removing their amalgams, and as time went on, their mood and their energy levels improved, and just looking at them, their skin colour and their vibrancy in their eyes was, really different. They no longer looked grey and sallow. And this was only after having a few amalgams replaced. And I noticed the same thing started happening for me. I was no longer so tired and sick, and I was no longer breathing in mercury vapour all day long. And these changes that I could not put down to anything else was the final piece of the puzzle that confirmed to me that holistic dentistry is the approach I wanted to take with my work. And from there, I did a lot more reading and researching, and I got mentored and trained, and the rest is history. So another question I get asked is, why is it so important to have mercury amalgams removed? Well, mercury is very, very toxic to human beings. In vapor form especially, it's the third most toxic non-radioactive substance known to man. So it's up there with lead and arsenic, and if you are exposed to mercury, it causes many nasty symptoms in the body. So we took lead out of petrol, we took lead out of paint, yet we're still mixing mercury as dentists and putting them in people's teeth. The World Health Organization says there is no safe exposure level for mercury. So any little whiff of mercury or ingested mercury causes harm and damage to the body. So when an amalgam filling is drilled, there's lots of friction that vaporizes mercury from the filling, and under normal circumstances, the patient and the dental team inhale that. The methyl mercury then passes from the lungs into the blood, where it can enter the cells, and it disrupts and interferes with their normal biochemistry. This adds to a person's toxic load. It increases the risk that that individual will go on to develop mercury toxicity, which can lead to symptoms of illness and disease. So by following a safe removal protocol where everybody breathes clean air, has respirator masks, there's air filtration, exposure to mercury vapor inhalation is massively reduced. So what's the process for safely removing mercury amalgams? Well, the teeth that we're going to work on are isolated within a rubber sheet, and so the tooth pokes up through the sheet and the sheet sits over the mouth. This collects any debris, so it doesn't splatter inside to the mouth tissues. It's not being absorbed or swallowed. We use sterile medical air, and that's delivered by a nose piece. We use a special amalgam drill, lots of water, special suctions, air purification and filtration in the surgery. And then we encourage our patients to get support with supplements and dietary things that will boost the immune system and the detox processes that eliminate mercury from the body. And it's good to do that under the care of an integrative GP or a very knowledgeable naturopath. So once those amalgams are out, what do we replace the fillings with? So amalgam gets replaced with non-metallic restoration. So either what's called a composite resin filling, which is a white filling, or a porcelain restoration or crown. The composite that we use at Evolve Dental is very biocompatible, which means it's in line with your body. It's non-allergenic. It consists of an Orsimer resin with quartz, silica and porcelain particles, so it's hard wearing and it's non-toxic. So why aren't more people told about mercury issues? Why is it not so widely known? Why is it that dentists will tell you it's safe? Well, I guess as a profession, many dentists do consider it still safe. That's what we're taught. And unless you question, then that's what you do. And apparently I was chatting to a good colleague of mine recently who's part of Australians for Mercury-Free Dentistry. And she was explaining something to me that I'd heard of, but I didn't know how true it was. And she was saying that dentists almost, and it's, you know, I'm going to maybe go out on a limb here, dentists kind of get addicted to the mercury toxicity. There's something about it that feeds the body. And I'm going to have to do a bit more research into this. We were only having this chat yesterday, so I haven't had time to go off and have a look. So there's some addiction going on about using mercury, and then also the ideals and beliefs that we've been trained in. And look, doctors are not trained really to look for mercury toxicity or toxins. They're treating the symptoms that you present with. And so until healthcare looks at a different way of looking at illness and disease, things like the smoking tooth video, which I would encourage you to go Google and have a watch on YouTube, are only going to be known about by a minority of people within their healthcare. Now, the smoking tooth video, they use infrared light that will show up mercury vapor, and they get a tooth that's filled with amalgam and they create friction on it, and you can see the mercury vapor coming off from the tooth. So if you haven't watched it, I would encourage you to do so. So if nobody's talking about the risks of mercury and the risks of dentistry in relation to that, how are we going to know? And this is why I do what I do. So what is my recommendation for people who still have mercury fillings? And how can they find a dentist like me? Well, I'm unique, so you should come see me. You get the best service. No, only joking. And what sort of questions should you ask to make sure that you get the safest procedures? Well, I'm going to encourage you to do lots of research, be sensible in your approach. There's going to be the extreme ends of any argument, so try and filter some of that out. Now, find a dentist who's SMART certified, that's going to use a rubber dam and the separate air supply and understands how to handle amalgam safely. Find one who's going to support you to recommend nutritional support and supplementation to help you through the process. And there's a really good website. It's the IAOMT site, and they have a list of practitioners. That's the International Academy of Oral Medicine and Toxicology. And there's also a thing called ACNEM, which is the Australian College of Nutritional and Environmental Medicine here in Australia, and they will also have a list of practitioners who can help you with mercury detox and dentists who work the same way as I do. But having said that, we get a lot of patients who travel. They come from far north Queensland, Adelaide, Perth, New Zealand, even the UK and Europe while they're over here in Australia. So, you know, it humbles me greatly at how far people are willing to go to make sure that they feel that this is being done in the best way for them. So, yes, I promote supplementation and nutritional support to remove any mercury that may be in the system. And so I do this often in conjunction with naturopaths and integrative GPs, but I can give you some nutritional tips for going through this. So we would recommend lots of protein, plenty of water, green leafy vegetables, things like coriander, garlic and onions, supplements like vitamin C, B6, minerals like magnesium and zinc, and good probiotics to get the gut going well. And you need mercury scavengers like selenium and glutathione, and you can use like alkalizing greens, liquid chlorophyll or chlorella as well. And so what's going to be my top tips to you? Well, if you want to be well, you've got to avoid toxins. You've got to avoid stresses in your life. You've got to look at what are the pillars of health. So I'm going to advise, avoiding things like gluten, alcohol, sugars, including complex carbohydrates, caffeine. I'm going to say eat lots of garlic, they're good for your immune system, have chili, drink plenty of water, and little tip, go to bed early, get some sleep, get some good rest, deal with your stress. And if you do have dental disease, untreated decay, infections, gum disease, you cannot have a healthy body without a healthy mouth. So I'm going to encourage you to visit your dentist, get a really good checkup and get all those things treated so that your mouth isn't going to be a source of infection, toxins or systemic stresses to the rest of your body. Thank you so much for listening. I'm Dr. Rachel Hall, holistic dentist. This is the Dental Zone podcast, and I've really enjoyed sharing the answers to some of the frequently asked questions that I get about holistic dentistry and why I'm a holistic dentist. Thank you so much for listening to the show. You can always find out more by jumping on over to holisticdentistry.au, or you can give my practice a call if you want to book in for a consultation or amalgam removal, 07 3720 1811. Until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.